This is Crystal Fenn with MedPage Today, here in San Francisco at the ASCO Genitourinary Cancers Symposium, where researchers have reported a concerning trend toward more expensive prostate cancer treatment. Dr. Paul Nguyen of the Dana-Farber Cancer Center explained his group's findings.
So what we saw was that among both patients choosing surgery and patients choosing to get radiation, both groups of patients between 2002 and 2005 were choosing the more expensive therapy, and that the use of the more expensive therapy was increasing very rapidly. For patients that were getting surgery, very few people were getting the expensive therapy at the beginning, but as it got introduced, its use increased greatly. And the same thing with the radiation. More patients were using the more expensive IMRT radiation over time.
It's not clear yet whether this rapid shift was an appropriate change toward more effective therapy or just a lot of hype.
Both of these more expensive therapies were adopted very quickly. There's a widespread use now. And whenever you think about something that's more expensive, you have to think about what the benefit is of this more expensive thing. And so far, there have been no randomized trials, which is the best kind of data, to try to figure out, is the more expensive therapy better than the less expensive therapy? And we do have some data. Looking back now, it's retrospective data that suggests that there may be some benefits, for example, to the IMRT as opposed to the conformal radiation. The IMRT seems to be associated with less rectal toxicity. But we don't have that really good kind of data, the randomized trial data. And I don't necessarily think that IMRT is a bad thing and we should stop using IMRT. Definitely not. I think it's got a lot of advantages that we've come to learn over time. But I think what this kind of research suggests is that as a society, when there's a more expensive therapy out there, people are going to flock to it and get excited about it, and its use is going to increase very, very rapidly. And we have to think about going forward about how we're going to test these therapies, or if we're going to accept them outright. And if we accept them outright, we know that their use is going to increase. We know that healthcare costs are going to increase because of that. We have to think very seriously as another expensive technology comes out. For example, proton therapy for prostate cancer, which people are talking about. Certainly, proton therapy has a lot of tremendous potential for lots of diseases, but it's probably going to be used pretty heavily in prostate cancer as proton therapy becomes more widespread. And I think as a society we have to think about trying to figure out whether protons are going to be better for patients than IMRT, and how much better are they going to be if they're going to be better, and is that price worth paying? I think that's the kind of thing that really needs a randomized trial to test.
So the trends seen in this study toward more expensive prostate cancer therapy have implications for society at a time when healthcare costs are an increasing concern. Here in San Francisco at the ASCO GU meeting, I'm Crystal Fenn, MedPage Today.